Did you know that there are lots of powders, liquids and other substances around the house and garden that can easily kill your cat or dog? Our pets will frequently come across these poisons unless special care is taken. In most cases, it is much better that you use an alternative than risk an emergency trip to your vet. Stick around to learn more about the top 10 deadly poisons around the house and garden for our pets. Hi, I'm Dr. Alex Avery from ourpetshealth.com, helping you and your pet to live healthier, happier lives. Now, the two most common pet poisoning scenarios are a cat or a dog eating human food that is actually toxic to them, or coming across something around the house or the garden that they really shouldn't have had access to and becoming seriously unwell as a result. Let's start off outside before moving indoors. Okay, number one is rat bait. There are several different types, with the most common being a warfarin or a warfarin-like poison. Rat bait is designed to be tasty. After all, that's why rats and mice eat it in the first place. This means though that if your pet can smell it, they're likely to try and eat it. Strong packaging is no match for a determined dog, and hiding it somewhere pet inaccessible is ineffective too. It can be moved by wildlife. If you have pets, never use rat bait. Simple. These poisons work by preventing the blood from being able to clot, causing our dogs and cats to effectively bleed to death. Now, this might be bleeding into the lungs and drowning, bleeding into their intestines or abdomen, bleeding into their joints, or even bleeding under their skin. If they eat enough, then without treatment, they will die. Thankfully though, there is a very effective antidote, but even this needs to be given for many weeks before your pet can be considered fully recovered. This is because the poison stays in the body for many weeks. There are other forms of rat bait that use a high dose of vitamin D, also known as cholecalciferol. This causes blood levels of calcium and phosphorus to become really high, and this damages many parts of the body, with the kidneys being especially vulnerable. Unfortunately, by the time a cat or a dog is showing signs of poisoning, the damage to the kidneys is often so severe and permanent that even aggressive treatment may not be enough to save their life. There is also no specific antidote, so if you have any suspicion your pet may have eaten this type of rat poison, or if they get into your vitamin D supplements, then it is essential they are seen by their vet straight away. Number two is another poison used to kill a common pest. Slug bait, or more specifically metaldehyde, is very toxic to our pets, and unfortunately it's also pretty tasty. This means that it's not unusual for our pets to seek out and eat really large quantities, and to make matters worse, because slug bait is so toxic, it would only take a tiny 18 grams of a strong 5% formula to be potentially deadly to a 20 pound or 9 kilo dog. Once eaten, metaldehyde is very quickly absorbed, and problems start about 1 to 3 hours later. It causes a patient to shake and bake. They develop tremors, which progress to full seizure, and body temperature starts to climb to a really dangerous level. Now, this high temperature is then responsible for secondary organ failure and death without rapid treatment and without aggressive treatment. I said this with rat bait, that if you have pets, do not use metaldehyde slug bait. It is deadly. Now, it's a hard choice to make, but I'd rate antifreeze or ethylene glycol as the worst poison on this list. Not only does it take as little as a teaspoon to kill a cat and a tablespoon to poison a small dog, the initial signs actually seem to improve, leading to a false sense of security, yet it is vital that treatment is started within the first couple of hours, or this poison is almost 100% fatal. Now, to start with, and often within 30 minutes, a cat or a dog may seem as though they've drunk too much alcohol, with incoordination, vomiting, drooling and increased urination. Between 12 to about 24 hours, they'll seem to get better and may even become normal, but inside their kidneys will be shutting down. This will show itself then as inappetence, lethargy, depression, vomiting, seizures and coma. And by the time this stage is reached, death is inevitable. Even if aggressive treatment is started early, the chance of success is very, very slim. When you are changing or topping up the fluids in your car, it's so important you don't spill any. A cat who walks through a small puddle of spillage would have enough soaked into their fur that they'll be poisoned when they groom themselves. Antifreeze also tastes sweet, so a dog will quite happily lap up any puddle left behind. Lilies might be found in the garden or in the house, depending on where you live, but regardless, they can be deadly for cats. To start with, this only applies to the true lily species of the Lilium or Hemeroculus species. Lily of the valley can also be deadly to both dogs and cats, but we'll consider that in a minute. The true lily contains a poison in its leaves, pollen and stem that causes a cat's kidney to fail. A cat can be poisoned by eating the plant, but poisoning can also take place if its coat gets contaminated with pollen, and this can happen just if a cat brushes up against a fresh bunch of flowers, which it eats then when it grooms. As with all poisons so far, rapid, aggressive treatment is important if we're to give them the best chance of making a successful recovery. Dogs are not affected by the true lily, but both dogs and cats can be poisoned by lily of the valley. This plant is similar to the foxglove and affects the heart rather than the kidneys. It can cause a low heart rate, an abnormal rhythm, possible seizures, and can also be fatal. Now, continuing indoors, and at number 5, is a surprisingly common but thankfully pretty harmless toxin. Glow sticks and glow jewellery contain a chemical which is an intense irritant. It is very bitter and causes some pretty severe looking symptoms which include profuse drooling, gagging and retching. Because it's an irritant, the mouth and the eyes may sting, and so your cat or dog may become quite distressed and start pawing their mouth and rubbing at their eyes. Thankfully though, while your pet may become quite agitated and the signs they show may be really alarming, the actual chemical is not very toxic, and so they should recover uneventfully. The next poison in the house, and at number 6, are household cleaners. Now this includes many different types, but the results can all be the same. Household cleaners, they're often very strong acids or alkaline liquids, and are not only irritant but can also be corrosive. Acids are generally bitter and result in a fairly immediate pain when they come into contact with the gums or tongue. Now this actually means that drinking large amounts is uncommon. Despite this though, there's still the potential for significant injury to their eyes, skin, mouth, intestines and lungs. Alkalines then cause a similar problem, but they are potentially much more dangerous. And this is because they are pretty tasteless and odourless, which means that larger volumes are often consumed. This increases the risk then of severe intestinal ulceration with the potential for perforation or rupture, which is likely to be fatal. As ever, prompt treatment is essential, and this can be started at home by flushing the affected area with copious amounts of water before seeking immediate veterinary treatment. Okay, at number 7 is another major cat problem. Permethrin is the most common pyrethrin or pyrethroid and is found in some dog flea and tick preventative medications. While a massive overdose would be harmful for dogs, cats are exceptionally sensitive to these chemicals due to their inability to break them down within the body. If these treatments are inappropriately applied to a cat, then they will quickly show signs of toxicity. This most commonly results in nervous signs such as tremors, twitching, incoordination, weakness and seizures. Vomiting, excitability, drooling and breathing difficulty can also be seen. Left untreated, poisoning can be fatal. If the product is accidentally applied, then it should be washed off straight away with soap. Now, a washing up liquid or dish soap is good for this. It's also important that the area is fully saturated and rinsed many times, as cat's long hair can make complete removal of any substance challenging. It's actually much less common for cats to be poisoned by coming into contact with a dog who's just been treated. Prevention is the safest plan though, so if you have both cats and dogs, then I would advise that you either avoid using these products on your dog or at least keep them confined for several hours while the product dries. If your pet is showing signs of toxicity despite having washed them thoroughly, or soon after you have treated your dog, then you should take them to your local vet clinic for treatment to ensure that a successful recovery is made. Okay, so at number 8 we have paracetamol or acetaminophen. Never give your cat paracetamol, not even a little bit, not even if you think they're in pain or have a fever. Cats are unable to break this down in the same way that people and dogs do. Instead, the liver breaks it down into a toxic chemical, and this results in severe liver damage and also prevents the red blood cells from carrying oxygen and delivering it around the body. After consuming paracetamol, you might notice that your cat's gums turn blue or look like chocolate. Their breathing will become rapid and they'll start to struggle to breathe. They will become depressed and their face and feet may also start to swell in size. As the body continues to struggle, vomiting will start and the urine will turn a dark brown. Unfortunately, by the time a cat is showing severe signs of poisoning, the chance of recovery is minimal. Even with prompt treatment, this poisoning is generally fatal. While cats are uniquely sensitive to paracetamol, dogs are not and are generally able to take acetaminophen without developing any problems. That said, it should only be given as advised by your vet. Dogs are not spoiled people and an overdose can severely damage their liver. Given appropriately though, it is generally very safe. Aspirin and ibuprofen are our other most common drug toxicity at number 9. Again, generally a result of being given to our pets inappropriately by well-meaning owners. Now, just like paracetamol though, our dogs and cats may also decide to chew on a packet left lying around and so be poisoned this way. Both aspirin and ibuprofen are examples of non-steroidal anti-inflammatory drugs or NSAIDs. While this type of drug is used to control pain in our pet population, very commonly only specific veterinary drugs should be given. Human types are simply not safe for either dogs or cats, and it is all too easy to result in a severe, life-threatening toxicity. Now, having said that, in very occasional and specific cases, small doses of aspirin may be given, but if that's the case, then they'll be recommended by your vet, and really tiny doses are given that are not pain-killing and not anti-inflammatory in any way. Intestinal signs of poisoning are most often seen, such as vomiting and diarrhea. Vomit may contain fresh blood, or the stools might be very dark and tar-like due to ulceration and bleeding within the stomach or guts. Any ulcers can also perforate, causing fatal peritonitis. As if this weren't bad enough, overdose can also lead to liver failure, kidney failure and seizures. Never give your cat or dog aspirin or ibuprofen or any other non-steroidal you may have at home. Okay, last but not least, at number 10 on our top 10 deadly poisons around the house and garden for dogs and cats is any other medication you may have in the home, human or animal. The most common reported ones are heart medication, antidepressants, ADHD treatments, cold and allergy medications and sleeping pills. It's also not unheard of for pets to seek out whatever medication they are themselves on, as many are designed to be palatable. For those individuals which really do view their medicine as treats, there is a very real potential for them to chew up the container and consume a whole month's worth of treatment given half the chance. I've certainly seen that in dogs eating all of their painkillers in one go. Signs of poisoning really depend on what drug your pet has eaten. By now though, you should be aware of what the most common symptoms of toxicity are. We've got vomiting, diarrhea, drooling, weakness and depression, being off their food or a change in their gum colour, rapid breathing, tremors, twitching and seizures. In some cases, a single tablet of a certain human medication can be enough to result in toxicity. This means that not only should you keep any medication safely locked away, when you're getting any out of containers, it's best if your pet is not in the same room, so that if they should be dropped for whatever reason, then they can be found before your pet has a chance to eat them. So I hope this video helps to prevent your pet from becoming poisoned by these deadly toxins. Make sure you also check out my video, The Top 10 Deadly Foods for Dogs and Cats. If you have any questions or if there's anything you'd like to see in future videos, then please leave a comment down below. I would really love to hear from you. Also, if it's your first time here, consider subscribing and hitting that bell notification to make sure that you don't miss out on future content and allow me to continue to help you and your pet to live healthier, happier lives. So until next time, I'm Dr. Alex from ourpetshealth.com, because they're family.